we are seeing neurological changes that show up similar to what we see with alcoholics, what we see with gambling addicts. We see that compulsive neurological change that impacts their dopamine system, impacts their serotonin system. It impacts the parts of their brain that have to do with, uh, ironically, morality, have to do with choice, have to
Yes.
do with containment. And when we recognize that, hey, this is a neurological issue, and yeah, there's some moral components to it because of the impact that the behavior has and the way you feel about it. But really, when we're trying to help you heal, what we're trying to do is we're trying to rewire your brain and address the neurological issue.
Yeah. I think it's so important because if we and anyone who works in treatment with SA knows this. Okay. It's always great when science can back up lived experience or anecdotal experience. Because anyone who works in treatment, anybody who works with sex addicts or porn addicts will be able to tell you that there must be some neurobiological nervous system based component because these folks are acting outside of their stated values. Why would I do something that I have values against, strong values in some cases, sometimes religious strong values or cultural values that are at war? And if we don't identify this well, we're also going to fall prey to this criticism of the sex addiction treatment community that we are somehow sex negative,
Yeah.
and that we're concerned about the morality of these behaviors. Stop, cut it out. You're bad and you're doing something bad. Whereas in real experience, folks struggling with this addiction know it's bad before they do it. They know it's bad when they're doing it, and they certainly know it's bad when they're done doing it. And what I mean by bad is they feel bad about it. They feel shame or guilt or sorrow, or they're grieving the results of the addiction and the behavior in real time, and they still cannot stop. These are fundamental identifiers of any addiction, right?
And I hear you identifying the difference between sort of like a, a moral sense. And so, what am I comfortable with and what do my values sort of lean into versus, hey, I have some curiosity around some sexual behaviors or some sexual experiences that I might like to experiment with that are a little on the fringe from what I've done in the past. That, you know, we're not, when we're talking about sex addiction, we're not talking about anybody who explores sexual stuff that's out on their fringe is an addict. What we're talking about is the behaviors become compulsive, it's out of control. They're doing it at times or in places or in ways that go against, their own value system. Um, and, they're having significant consequences because of that in their life, and they're continuing the behavior even though there's a part of them that doesn't want to. And then the other piece that we talk about is that escalation piece.
Yeah, escalation, compulsivity, and consequences. That's how we usually identify an addiction. Is it getting, do I need more and more and more of it? Am I putting things on the line to do that? Compulsion, do I do it when I was on my way to doing something else, or I would rather be doing something else, right? And am I experiencing severe consequences in my life and the behavior is persisting? That is not kink or exploratory behavior or um, conscious non-monogamy. These are things that are bringing great harm to their life and their loved ones.